Welcome to St. Agnes MEDITECH EMR Part 2. As we reviewed in the EMR overview, the menu panel is located on the right. We will begin our review with the 24-hour panel and continue down until we have reviewed the summary panel. The encounter and referral panels are not currently used at St. Agnes. Overview of the 24-hour panel. The 24-hour panel displays vital signs, I&O, laboratory results, and diagnostic reports. The buttons at the top of the screen let you select the current day or one of the preceding 4 days for which to view the data. Each day you will view the panel. The weekday button labels change, so the last 5 days will always appear. Click the button of the appropriate data to view the data for that day. The Vital Signs 24-hour panel. The Vital Signs panel displays a graph of temperature, blood pressure, pulse rate, respiratory rate, and bedside pulse oximetry. The graphs are divided into 30-minute periods measuring from midnight to midnight. On the graph, the last measured minimum and maximum period values are documented. The 24-hour intake and output panel. This panel is divided into 6 4-hour periods beginning at midnight. The panel contains the following: total intake cumulative from midnight, total output cumulative from midnight, fluid balance, which is intake minus output, total urine output cumulative from midnight, and weight if documented. The 24-hour reports panel includes microbiology and imaging reports and pathology. Reports can be viewed by clicking on the time and date. Use the 24-hour laboratory panel to view results from lab and blood bank for a specific day of the week. The panel includes the name of the test, results, collection, date and time, and associated specimen or result comments. To view the comment, click in the comment bubble. Next is the Vital Sign panel. Vital Signs display data in a spreadsheet format. Temperature, pulse, respiratory rate, blood pressure, oxygen delivery method, and FiO2 if documented. Abnormal results are displayed with a yellow background. Some providers prefer to see vital signs in a graph format. MEDITECH allows you to graph vital signs and other data that is numerical value. Use your mouse to right-click on the label and select Toggle for Graph. This will highlight the item green. Then select Graph located in the footer. Next is the I&O panel. The I&O panel displays intake and output values. The buttons at the top of the screen allow you to specify the time intervals by which you wish to break down the information. The default view is 24 hours. The earlier and later buttons, located in the footer, allow you to view the next and prior 6 columns of information. I&O is totaled at midnight. The last column is a running total of the current day. The next panel is Notes. By selecting Assessments and Notes, it is the best way to view caregiver documentation in a text format. Use the filter buttons to display a particular type of documentation, for example, nutrition notes. Although some provider notes might display here, it is always best to use Other Reports panel where both dictated documents and electronic documentation will all be displayed. To view documentation, click on the time and date and a window will open and display the information in a text format. Caregiver documentation from other panels, for example, vital signs, I&O, or care activity, can all be viewed here. Sorting the Notes panel. The EMR initially sorts notes by date and time in reverse chronological order, that is, the most recent note at the top of the panel. To change the sort order, click the column header you wish to sort, for example, User. The filter buttons at the top allow you to view notes by specialty. The following type are used at St. Agnes: nursing, social services, respiratory, physical therapy, speech, nutrition, care coordinator, occupational therapy, pharmacy, support services, other, and surgery. Overview of the medications panel. All medications ordered during a patient visit appear on the medications panel. The View selection buttons allow you to view active, discontinued, or all medications. The default view is active medications. The medication list contains a maximum of 75 entries per screen. If the record contains more than 75 medication orders, you can use the previous page and next page buttons located in the footer to view prior and subsequent sets of 75. The table lists the generic and trade name, the dose ordered, the SIG, schedule, route, PRN reason, order start and stop time, total to infuse, status, drug class, and last administration. Discontinued medications appear on the active list with yellow highlighting for 1 day following discontinuation. After 1 day, they appear only on the discontinued and all list. To view the medication detail screen and history screens, click the box that contains the medication name. The medication detail screen then appears. To view chronological medication history, click the History button at the top of this screen. Viewing medication administration screen. On the medication panel, to view the administration history, click the box that contains the date and time in the last admin column. If the cell is blank, the medication has not been administered. On the medication administration screen, if a comment or query have been documented, they will appear here. Click on the comment symbol to view the comment. In this example, the medication was not administered because of the blood pressure parameters. Next is the Order History panel. Order History displays all the orders for a selected visit. Orders can be sorted using the yellow headers or detail viewed by clicking on the time and date, as seen here. Next is the Laboratory panel. The Laboratory menu option is used to view information for the following categories: hematology, blood gas, coags, chemistry, urine, toxicology, other body source, immunology, miscellaneous, and serology. The following is an example of Laboratory Hematology panel. Viewing the Lifetime Summary. When you select Lifetime Summary option, the system initially displays the most recent information for any items entered over the lifetime of the patient visits. However, you can also view a complete history of all the items by clicking on each element. Use the filter buttons to select a time period. In this example, we are viewing all of the potassium results. To view the entire results, click on the blue eye in the far right-hand column. After clicking on the blue eye, we now see the complete result for the BMP. Other visits. To view data across multiple visits, select the Other Visits panel located in the right-hand menu bar near the top. This will display the current visit as well as all of the historical visits. Rather than trying to find information on a specific visit, it is possible to view data across multiple visits by selecting View All. Now viewing multiple visits, you will see multiple displayed on the right-hand side in the patient header to indicate the data you are viewing is across more than one visit. This allows the user to evaluate trends and history. In this example, toxicology results are displayed for a sample obtained in 2014 and another in 2015. The function is available for most panels, like lab, micro, path, imaging, and other reports. So when reviewing a record for history and trending, many providers find that this is a time saver. The Microbiology panel. The micro panel includes 3 columns. The left column includes the date and time and name of the report and the specimen status. The middle column includes the specimen and the results. The right-hand column includes a notepad icon and a sensitivity grid icon. Click the notepad icon to view the report. Select the grid icon to view sensitivity if it is available. The blood bank panel. The blood bank summary panel displays blood type, types and number of units ordered and transfused, and the result of blood factors, for example, hemoglobin, hematocrit, or platelet count. The blood bank test panel displays dates and times of blood typing, antibody screens, and cross-match details. The blood transfusion history panel lists transfusions that the individual received during selected visits. To view reaction and transfusion comments, click the comment symbol. The pathology panel. Use the pathology menu to view pathology reports. The most recent specimen appears at the top of the panel. The pathology panel includes 3 columns. The left column of the panel includes date and time of the report, the middle column includes the name of the report, and the right-hand column includes the notepad icon. Click the notepad icon to view the report. Like laboratory, you can view historical information using lifetime summary or other reports. Imaging panel. Use the imaging menu to view imaging procedures. The status field pertains to report status only, signed and draft. Click the comment symbol to view the report. Like lab and blood bank, you can use the lifetime summary or other visits to view historical data. If the report has an associated PACS image, you can launch the image viewer by clicking on the camera icon in the image column. Sorting the panel. From the selected visit screen, you can sort exams by date, exam, or status. To select a sort order, click the yellow header. For example, click the report name header to see the same tests sorted together. In this example, you see abdomen x-ray has been done twice. Other reports. Use this menu option to view various reports and documents sent to the EMR. You can use the View Selection filter buttons at the top of the screen to select specific types of reports you wish to view. To view a dictated or electronic document, select the comment symbol to open the report. After you view a report, a green check mark appears inside the comment symbol. When you view another patient record or exit from the EMR, the green check mark will disappear. Scanned reports. St. Agnes scans paper documents and will become part of the electronic record. All scanned documents appear with a scanned status. Scanned documents are opened by clicking on the camera icon. Once opened, use the buttons on the right to navigate. You can zoom in or out, rotate, or go page to page. Cardiology links. Cardiology exams are found in other reports under the cardiovascular system, with a camera icon that will link to the cardiology PACS viewer. Select the camera to view the report and image. Care Trends panel. The Care Trends menu option displays items grouped by body system and special categories, for example, social, psychosocial, and education. To view a history of an assessment, click the yellow box that contains the data item, for example, agitation sedation scale. Here you see all of the times that this item has been documented and the resulted number. To view a snapshot of the assessment that occurred on a specific date and time, click the yellow box that contains the date and time. Care Activity panel. Use this panel to view care activities such as nursing and respiratory therapy documentation. This option displays multiple assessments together, allowing you to view them in context with each other and compare information that would otherwise be found in separate locations. The 3 most recently documented assessments appear in the first 3 table rows, with other documented assessments listed below them. You can use the negative or plus symbols located next to each assessment to collapse or expand the data in that section. The remainder of the assessments are collapsed below. To view any of these, use your mouse to right-click on the assessment title and then click the display located in the footer. A plus symbol next to an individual data item signifies more than one value exists for the same time period. You can click on the plus symbol to view a detailed screen that contains all the values for that category and time period. When notes are entered and associated with an assessment in the patient care system, a notepad icon displays in a row labeled Note. You can view notes associated with the assessment by clicking on the icon. You can also view care activity by date, name, or recorded by. This can assist you in finding a particular piece of documentation. The History Panel option displays a group of panels that show the responses to questions asked during the medical history assessment. The responses are put into categories for display. This graphic shows an example of the History Panel. The Summary Panel contains general information about an account in the selected visit, grouped into the following subpanels: Summary list, diagnoses, indicators, risk legal, demographics, providers, visits, contacts, insurance, and abstract. Information under each of those tabs can be viewed by clicking on the panel button. The summary list is a snapshot of this patient. It shows the most recent visits, the problem list, current inpatient meds, home meds, and the last time they were updated, preferred pharmacy, health maintenance information, growth charts in children, and substance use. Thank you for viewing St. Agnes MEDITECH EMR Review Part 2. Please select the link below to record completion of this section.